Viral hepatitis. Common causes of viral hepatitis are hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E, less commonly by cytomegalovirus and Epstein-Barr virus. Rare causes are herpes simplex infection and yellow fever. Characteristics of viral hepatitis are serum unconjugated bilirubin is increased. ALT is higher than AST, slight increase in alkaline phosphatase and GGT, and increased urobilinogen in urine. Hepatitis A, incubation period is 15 to 45 days, 2 to 6 weeks. Caused by enterovirus, which is a RNA virus, it is an infectious hepatitis, spread by fecal-oral route. Blood-borne infection is rare. It has no chronic carrier state. Does not leads to chronic hepatitis. Anti-HAV antibodies IgM present during acute illness. Anti-HAV antibodies it persists for years after infection. Also elevated bilirubin and aminotransferases. Hepatitis B, its incubation period is 45 to 180 days, 6 to 24 weeks. The only DNA virus which is characterized by presence of DNA particles, transmission through parenteral, sexual or vertical route. Carrier state is present in hepatitis B infection. Chronic hepatitis in 10% of immune-competent persons. It is the most common cause of chronic liver diseases. Increased incidence of hepatocellular carcinoma. Markers of hepatitis B infection. HBsAg. Reliable marker in acute hepatitis B infection. It lasts for 3 to 4 weeks, or up to 5 weeks. If present more than 6 months, it indicates chronic infection. Anti-HBs. It appears only after 3 to 6 months of infection. It can persist for many years. Its presence in blood indicates either previous infection or history of vaccination. HBsAg core antigen, it does not found in blood. Anti-HBc appears early in the infection. Anti-HBc IgM can reveal an acute hepatitis infection when the HBsAg has disappeared and before anti-HBs has developed. Chronic hepatitis B infection is diagnosed by presence of HBsAg and anti-HBc IgG. HBAg, also known as envelope antigen. It presents only transiently at the onset of illness, which reflects active replication of virus in the liver. Anti-HBA, it indicates low viral replication. HBV DNA. HBV DNA found in saliva, urine, semen, vaginal secretions, etc. Hepatitis C, also known as non-A, non-B hepatitis. It is caused by RNA flavivirus. Transmission by parenteral route, mostly seen after transfusion of blood or blood products. Carrier state is present. 80% are chronically infected. Detected by presence of anti-HCV or HCV-RNA. HCV-RNA indicates active infection. 20% of infected persons can develop cirrhosis of liver in 20 to 40 years. Hepatitis D, there is no independent existence. Require hepatitis B virus for replication. Detected by presence of delta antigen and anti-HDV antibody. Vaccination against hepatitis B prevents hepatitis D. Hepatitis E. Hepatitis A is a RNA virus, endemic in India, and mostly in Middle East. Route of transmission is fecal-oral. It has a self-limiting character. There is no chance of chronic liver disease. This is the most common infection among pregnancy. It can be detected by presence of IgM anti-HBe. No active or passive immunization available for hepatitis E. Thank you.